What is the best rhinoplasty technique, open or closed? A lot of this depends on the way that your surgeon prefers to do rhinoplasty. Many surgeons prefer open, many surgeons prefer closed. This depends on how they can get the best results for you and for your nose. Personally, I do most of mine open. I have the best control of the cartilages. I can see everything better. I can get them in the exact position that I want. This tends not to have that much more swelling. You have a tiny incision that tends to heal really well, and I get the best long-term result this way. For most of the time, the only time I use closed is if it's very subtle changes, small changes in the nose that doesn't necessarily need to be open, or if it's a functional rhinoplasty, we're really just looking to improve the breathing. Other surgeons prefer closed, and they do the majority of their surgeries closed. So this is something to discuss with your surgeon of which way they prefer and which way they can get the best result for you. What is an open rhinoplasty? An open rhinoplasty is where we place a small incision right here in the columella of your nose. This is extended into your nose, and then we are able to see the entire nose from the bottom all the way up to the top of the nose. This is what I prefer for the majority of my rhinoplasties. I have the most control of the anatomy. I can place things exactly where I want them to be, and I can see it the best. What is a closed rhinoplasty? A closed rhinoplasty is where we place the incisions inside the nose. So there's no external incisions, no external scars, and all of the changes to the nose go through those incisions inside the nose. What is ultrasonic rhinoplasty? Ultrasonic rhinoplasty is a technique that uses different machines with ultrasound to make cuts in the bone. You can do this either with a very tiny little chisel or a rasp, which is kind of like a fingernail file, or with this ultrasonic device. This device makes these tiny cuts in the bones to shift them and make them look the way we want them to look. This is a preference of the surgeon if they prefer to use ultrasonic or not. It does have additional cost, sometimes for the patient, sometimes for the surgeon to use this device. It can have less bruising and swelling. Depends on the way that the surgeon does the rhinoplasty and how that compares to a regular rhinoplasty. This is really a surgeon preference, and it's just a tool in our toolbox, and it is not necessarily something that makes the difference of this is a good rhinoplasty versus not a good rhinoplasty. What is liquid rhinoplasty? A liquid rhinoplasty is changes to the nose with soft tissue fillers. This means that we numb your nose with a topical lidocaine, and in the office, we're able to inject filler like Restylane or Juvederm into the nose to make changes to the external appearance. This is something that you can see right away. It's a way that you can try out changes to your nose and see if you like the way that that looks. But it is not permanent. This will last somewhere between 9 and 12 months, depending on the filler that is used. So if you like this is something that you would need to continue to do, or maybe consider having a surgical rhinoplasty if you like those changes. Have questions? Schedule a consultation anytime. I help people like you every day. Thanks for watching.